Let's bring you this discussion now. Parliament has agreed to give the proposed tobacco bill a new lifeline. Lawyers, or rather lawmakers, have agreed to send legislation proposing tough new tobacco laws back to Nedlac for review. Let's get your reaction to this now. We're joined by the co-founder of Vaping Saved My Life, that's Gcoyi, and Asanda is the CEO of the Vapour Products Association of South Africa. To both of our guests, thanks very much indeed for joining us this afternoon. Asanda, can we kick off the discussion with you this afternoon? Is it surprising to you that Nedlac was not given an opportunity to interrogate the draft tobacco bill when it was tabled in Parliament in 2022?
Good afternoon, Michelle, and thank you for the opportunity. No, it is not surprising. I have been involved with this bill since it was first published for public comments in 2018. And as far back as 2020, we've been calling for this bill to be tabled at Nedlac. And that was the realization that it carried so many different views on the either side, and it needed someone to sort of mediate. But obviously, because the tobacco and the Department of Health rather does not talk to the tobacco industry, we were unable to find each other during the engagements that we've had. So our view was that the Department of Health did not want Nedlac to meddle, as they said, with the bill, simply because they were going to find that there are many flaws with this bill, which is what we've been saying all along.
And in your opinion, if you were to agree and say there are many flaws, what would that be on the part of the Department of Health, in your opinion?
I think the basis on our end, I mean, you would know that this bill seeks to regulate vaping products for the first time. Mm-hmm. So when you start with regulation for a new product, for a new industry, you need to have a lot of understanding of what it is that you're regulating. And in our view, there's very limited views or limited understanding from the Department of Health what vaping products are and are not. Or if they do know, they simply discard the science that says that this could be a tool that can be used effectively for public health imperatives. So for us, the basis is on how you classify vaping products, and that is under the umbrella of tobacco harm reduction, which is where the differences are with the Department of Health.
Gcoyi, it's tobacco harm reduction, but would you agree that we still don't know enough about the impact and the health implications of vaping?
No, certainly not. I completely disagree. Mm-hmm. Given the fact that this product has been available for nearly 20 years now, and if we look at, for example, tests around biomarkers, it's very clear evidence that when compared to tobacco smoking, the impact on the biomarkers of harm are significantly less, significantly reduced, even to points where they are similar to those that do not smoke or vape. Mm-hmm. So we do know this. I mean, we need to remember we're now in 2024. We no longer require 50 years of research to understand the extent of harm with regards to any innovation that's brought to our society. If we can think just in 2021, when we released the mRNA vaccine, it only took us 9 months from development to full release, because we quite clearly understood what impact these vaccines could have on society. The same thing applies with a whole host of other new drugs that have been released recently. They don't require 20 to 50 years. We know very well with the level of sophistication in medical science and a great understanding of what products and what chemicals can do to the body, we are able to turn around some of the most remarkable innovations in a very short space of time.
But critics will say it's better and perhaps healthier compared to smoking. But vaping on its own, Kurt, and I mean, the name of your organization says it all, Vaping Saved My Life. We know that it's used as sort of a measure by a number of people to get off of cigarettes. But on its own, the impact of vaping, do we have enough of an understanding of that?
Well, not really, because, I mean, there's very little research with regard to people that are nicotine naive or have no smoking history, because the numbers are quite low. The gross majority of individuals that do vape do have a smoking history, so it becomes very difficult to weed out where the harm, whether from smoking or vaping. But based on the fact that when we look at individuals that were smoking and look at their biomarker levels and look at their health and then compare it to once they switched, we see significant differences in those levels. We also have to, first-hand testimonials from individuals, particularly on our website, as well as many around the world, where individuals that had smoked, like myself, for a very long time, suddenly once they had switched over to vaping and removed combustion and smoke from their lives, they do feel significantly better and are able to live a better quality of life. And that's the point.
Yeah, absolutely. Asanda, it's obviously better than combustibles, cigarettes that we light up using a flame. But, in your experience, how much more do we actually need to know about the dangers of vaping in a society like South Africa that struggles with substance abuse?
I think what we need to keep in mind, Michelle, is that South Africa has over 12 million smokers. And instead of the numbers going down, they've been going up. So clearly, our public health strategy is not working. So what we need to start doing is looking at what we're currently using to encourage people to quit smoking and recognize that there are gaps. And the biggest thing right now is what else can we be adding to this toolkit that can assist individuals who, one, want to quit, or those who actually don't want to quit, but they are addicted to their nicotine. So our call has always been, let's expand what's available to smokers. Let's educate South African smokers, because we agree 100% with the Department of Health that it cannot continue like this. Smoking kills, and we all need to do our bit to ensure that we save the lives of those 12 million smokers. But we cannot do it simply by following a template and not trying things out that have been working in other countries. So that is something that we've been calling for.
Kurt, let's educate smokers about the alternatives to smokers, but at the same time, let's educate our young people about the dangers of things like vaping.
Well, absolutely. I mean, I'm a father. I'm married to a pediatrician, and I really do believe that we should do a lot in terms of educating non-users, non-nicotine users, especially the youth, not only the harms around smoking, but, the risks around taking on nicotine, because it is an addictive substance. But we need to remember that, for example, in the UK, where just last year they introduced 1 million free vapes to people who want to quit smoking, who are unable to do so through their smoking services. We look at, for example, in New Zealand, who very, very, abruptly changed course from banning vapes to now becoming a product that they promote, even through their Prime Minister's office, where we see smoking rates reducing significantly. So I think that is the single biggest thing that we should be doing, is educating not only our youth, but other people that do smoke, that these products are significantly less harmful. It doesn't mean that they're harmless, and they could very well assist you in helping you achieve the goal that you seek to do, and that's reduce the harm as well as quit smoking. It's critical that we do this. But we also have to explore every means possible to help the 10.8 million adults currently smoking daily in South Africa, because at the moment there's very little for them out there. It's just a quit or die, and that's only available to them.
Yeah, I imagine, Asanda, that our legislation is going to have to evolve in the same way the UK has. I think coming into effect in the very near future is the UK will be outlawing the use of disposable vapes, an incredible litter problem, millions of disposable vapes being discarded in the UK every single day. And that's something that in time our legislation also needs to come to grips with.
Indeed. And I mean, I've always said that we need to learn from what other countries are doing. Where we are, the UK was right where we are, I'd say, about 7 years ago. So they've had the experience of putting legislation in place, trying things out, etc. But we've then got the advantage of not having to go through some of the challenges that they've gone through. And in particular, the issue of youth access prevention, which is why from our end as an industry body, we've always advocated for, let's look at a licensing framework. We are willing to look at options or ways in which we can limit access to our products to young people. Let's look at the issue of branding and packaging. It is a concern because you've got legitimate vaping businesses that are doing their utmost best with their packaging, their labeling, etc. And then unfortunately, you've got those unscrupulous individuals and companies that just don't care. And those are the ones that give the industry a bad name. So I think it's really important that as an industry, we also look at our faults and say, what can we learn from other countries? And for us right now, the priority is doing all we can, using legislation, of course, to ensure that young people do not access our products unnecessarily.
Yeah, certainly. Parliament agreeing to give the proposed tobacco bill a new lifeline. Let me thank both of our guests for your time in helping us unpack this story. The co-founder of Vaping Saved My Life, Gcoyi, and Asanda is the CEO of the Vapour Products Association of South Africa.